As daily power cuts fast become a norm, spare a thought for the infirm and seriously ill patients in hospitals across the country. Although many facilities do have generators, they were not meant to be switched on and off for about 4 to 6 times a day. Load shedding has increased the need for diesel, and the cost also compounds the situation. The Hospital Association wants an exemption for all hospitals, as this affects the elderly, it affects critical surgery and is a risk to patients. Yesterday, Health Minister Dr. Phaahla said that engagements are currently underway with Eskom to facilitate a plan to exempt all healthcare facilities across the country from load shedding.
Well, the Eskom prescription of load shedding is not good medicine for hospitals like these. So public and private hospitals are in desperate need of a shot in the arm. At the Netcare Group alone, there were 3,157 power outages since October last year. When SABC News arrived here at the Mill Park Hospital, 11 acute facilities under the group countrywide had been load shed.
You must also remember that if you're well prepared in case of an incident. Doesn't mean an incident doesn't happen. We have had hospitals where power outages have happened and the generators have failed to start. The reason for that is they're only pieces of equipment that are meant to be used once, twice, 3 times in a lifetime. But here we're using them 9, 10 times a day, 8, 9, 10 times a day, on, off, on, off. It's a piece of equipment. It's not designed to function in the way that they're functioning at the moment. Ours, thank goodness, are functioning fairly well and really well at the moment. We've got a good technical team that looks after our hospitals. We've got really dedicated staff. But there is the possibility of a generator not starting. And that then means that the power to the hospital has to be solved immediately. Whether that be that another generator will start or whether it be that our staff start it manually. But what we have seen is we've also seen a problem with infrastructure that supports the hospital. So if a transformer goes on and off and on and off and on and off, we saw in Pretoria a few months ago where their transformer exploded after a power outage, which then meant we were on load shedding or on power outage for 10 days. Now we sustained that hospital. There wasn't a single patient that was at risk. But the issue is the risk is to us, and as a company, we are responsible for people's lives. And we're responsible for equipment, we're responsible for infrastructure, and that makes it difficult.
SABC News was obviously unable to speak to any patients due to privacy regulations, but the group says there's been a huge impact on operations, making patient care more difficult. Well, this graphic shows that in comparison to all other incidents that may occur, power outages are the biggest headache. A snapshot of views from the streets bear this out. South Africans are tired, angry and frustrated.
The biggest thing is the fact that we keep on paying for more electricity. The tariffs keep on going up for a service that we don't have. So that's one of the biggest issues that I have.
Because normally, even when we go to work, we need to wake up early in the morning to accommodate the robots because the traffic is bad. We drive long hours.
Well, the Hospital Association of South Africa says while it lauds the minister's intervention, the number of hospitals which will be exempt is still too small to make a significant difference.
We're talking around 10% of hospital numbers. We have a long way to go and a complex issue, and we do appreciate the minister and the department's efforts in this regard. Our concerns are twofold. There's an operational aspect and there's a patient care aspect. You know, the one is affecting the other, and it really applies to all hospitals everywhere, in particular acute hospitals. So in the operations, for instance, there's a degradation of machinery. Medical and surgical equipment is really not built to be switched on and off constantly several times a day. And some of this machinery is complicated, they have to be protected. So that is one problem. The other problem, of course, is that generators are not meant to be switched on and off at the frequency that they are now. And then there's also the cost of operations. Diesel prices have gone up exponentially, as we all know. Then there are also other problems like supply as we've seen in the case of Eskom. So the cost of operations is becoming a bit of an issue. Budgets have to be balanced to make up for unbudgeted expenditure for diesel, just to keep the generators going. And then, of course, that whole operational complexity is having an impact on the quality of care.
While South Africa is facing a crisis on several fronts, frequent power supply interruptions has had a cascading effect on the economy, business and healthcare. Criselda Lewis, SABC News in Johannesburg.